Alright, go.
Okay. Front of the heart is clean, back of the heart is a big mess. So this is always the anterior side. The larger side is the left ventricle. The point is the apex. Smaller side is the right ventricle. This is the right atrium. This is the left atrium. This opening right here that's cut on the front of the heart, if there's a pin going inside it, they want the pulmonic semilunar valve. This is the pulmonic trunk, so at the base of it would be the pulmonic semilunar valve. Coming up right here is the aorta. You can see the first artery coming off the aorta is the brachiocephalic artery. The next one is the left subclavian artery. Here's the end of the aorta. If you follow the pulmonic trunk all the way around, these are your openings for the pulmonary artery, right here and here. Below them, the openings for the pulmonary veins. And below that, this large floppy opening right here is the inferior vena cava. If you look below the inferior vena cava and pulmonary veins, this is your coronary sinus. Coming up from the other end, the other side from where the inferior vena cava is the superior vena cava. It's always going to be in line with the brachiocephalic artery. Again, messy side of the heart is always the back side of the heart, so we're on the posterior. This area right here, in between the ventricles, is the posterior interventricular sulcus. Other side, we have the anterior interventricular sulcus. The artery that's going through there just has the same name, anterior interventricular artery. Same on the back, posterior interventricular artery. The shiny outside covering of the heart is the epicardium. If we open it up, the tissue, the meat of the heart, is called the myocardium. And the shiny inside surfaces are the endocardium. The larger ventricle is always the left side. Smaller is always the right side. Inside the right ventricle, and only in the right ventricle of the cow, is a band of muscle that goes from one side to the other called the moderator band. Then we have also in the right side the tricuspid valve. Left side is the bicuspid valve. Attached to the valve are the chordae tendineae. The chordae tendineae attach the valve to the papillary muscle. You can see right here the papillary muscle. It's a big lump right there. If you look above the papillary muscle, in this case at the very bottom of the ventricle, these grooves and ridges that look like the roots of a tree, and you can see them on that side as well, those are called the trabeculae carnae. So papillary muscle, trabeculae carnae, chordae tendineae, bicuspid valve. If you come all the way down to the end of the ventricle and then shoot straight to the center of the heart, you will see these flaps right here and here. Those are the parts of the aortic semilunar valve. And you know they're going into the aorta because if you follow that, it takes you outside to the opening of the aorta. Let's see, is there anything else? Trabeculae carnae. Oh, the wall between the ventricles is the interventricular septum. And I think that's it for the heart.